What's going on, everybody? Welcome to the latest episode of the Get Stuff Done podcast. My name's Caden Cleveland. Of course, we have the executive director of OMES here, Steve Harp. Steve, how you doing?
Good to be here. Yeah.
Doing
great.
all right?
Yeah.
Good. So our guest for this week, I'm really excited about. We have the Commissioner of Health, Commissioner Lance Frye. How are you doing, sir? Good to have you here.
Great. It's excellent to be here.
Thank you so much for being here. We have so much to talk about, a lot of COVID-related topics, but also we're going to dive into a lot of what you have going on at the health department. A lot of things that we can dive in, learn from, just get some of your expertise, honestly. So
it's interesting. We ask everyone that comes on. This is podcast number 5. What got you in the state government?
I want to say the wrong place at the right time. No, I don't know. I was in the right place at the right time.
know
we've
exactly
had
how
a few
you
people
feel.
on. Our last episode was with Chip Keating, and he pretty much, pretty close at the same episode. We started out and said, so you have pretty much the most exciting job in Oklahoma, but then we one-upped him with your job.
Yeah.
Your job has just been a chaos the last few months.
Been.
I mean, walk us through that. What's that like being in your position with a pandemic going on? Is that just absolute craziness?
Well, wait a minute. Before you answer, he accepted the job because he was on the task force. So I'd see him over at the Armory all the time when we were doing the governor's briefings and daily.
Mm-hmm.
So not only did he join during a pandemic, he joined knowing we were in a pandemic.
Yeah.
So kudos to you, Commissioner.
Yeah, absolutely.
That's good.
Well, I kind of had a unique opportunity because I'm an OBGYN normally, and I work for OSU, but I'm also the state air surgeon for the Air National Guard, which is the senior medical officer for the Guard, so the advisor to the TAG and governor for any military, any medical issues for the military for Oklahoma, and FEMA liaison, all that kind of stuff. So
quite a resume with all this. Holy cow!
So when a pandemic came along, then I got called down to Oklahoma City through the National Guard to and put on the Governor's Solution Task Force. So I had the opportunity to, that was back in April, I had the opportunity to really see where the dysfunction and breaking points were and where the good things were as well. But I had been doing this job pretty much from the Air National Guard side of things for a while before and that's really why the governor asked me, because I'd been doing it there anyway. And so then he called me and asked me if I'd be willing to take the job. So I kind of knew what I was getting into and did it anyway.
So how much of it has been like, because you knew you had the experience going into it, but then you actually got into the role. Was it a seamless transition, or was it more than you expected? Kind of walk us through what did that look like?
Well, there was a transition because I had the National Guard behind me, and at that time, the National Guard started taking some of the people off of the deployment.
Okay.
And kind of working their manpower down. So I didn't have all the same people working with me that I did before.
Gotcha.
I had some of the same people, but had a new agency.
Right. Your natural change in position around different people is that sort of transition. But as far as knowing the experience going on, you had a bit of a head start when it kind of came into the actual what you were getting yourself into. It sounds like
I did.
Okay.
Yeah.
So interesting. So I saw the press conference today, which if you haven't watched them, go back on Facebook or YouTube and find them because they're excellent. But you said something today that struck me, which I thought it's open, honest, but super cool. You talked about modeling, and you talked about the one thing, tell me if I don't capture this right, but the one thing about modeling that it's taught us is that all the models are wrong or have been wrong.
That's right.
Talk a little bit about your feeling around that comment and modeling in general.
From what I can tell, I mean, modeling is very dependent upon the person who's doing the modeling.
Sure.
I mean, they can really, I think, slant it into their own bias one way or the other, depending on which way they want to look at a certain topic.
Right.
But so far, my experience with it is they have always overestimated the effect of whatever modeling they've been looking at. So, for instance, when we first started this, the COVID response in Oklahoma, the epidemiologist for the state gave an estimate that we'd have 5,000 people in the hospital and 30,000 Oklahomans would have died.
Right.
And it just hasn't happened. We never got to that point. But that's what we had to work on to begin with under those expectations.
What's been your perspective on, the governor had a tough choice to make. He had to decide, to bring business, open schools, and work with Superintendent Hoffmeister on that. At the same time, we're still, battling the pandemic, and it seems like I stay off Facebook as much as I can these days, but it seems like the public in general you get mixed results on that.
Right.
In terms of the health department, how have you been able to navigate that? Because you're caught right in the middle of all of that decisioning.
Yeah. Obviously we wish there was no COVID.
Sure,
we don't want anybody
yeah.
to be in the hospital
Yeah.
or be sick, but it's simply going to be with us for a long time.
Mm-hmm.
And I think that, honestly, the governor's handled it extremely well. I mean, I look at other states and what they've done compared to us, and we were able to he shut everything down initially, everything except for essential businesses.
Mm-hmm.
So non-essentials were closed. Did the safer at home for people that were at high risk order. He did over 30 elective orders in order to kind of do everything from what we talked about to stopping elective surgeries and multiple things to be able to help us kind of get through that
Right.
initial phase and prepare for really to get our healthcare prepared for the eventual surge that we knew would happen.
Huh.
We had no PPP on hand. We had 1 day supply that was all expired.
Right.
We had no healthcare surge plan. We had no in-state testing capacity. So we were really caught off guard and unprepared.
Wow.
All of our technology was very, very antiquated. So we had a lot to do to get ready for the surge. So it did exactly what we thought it would do. He, flattened the curve and pushed it off to the right, delayed it until we were better prepared. And once we went through a phased reopening. So, we had opened up a part of the economy, watch it for a couple of weeks, watch all the numbers and
Right.
see what happened. And if it met the gating criteria, then we would go to the next phase. And I think it worked beautifully. I mean, we knew that the numbers were going to come up eventually when
Sure.
people start socializing, but
Right.
you got to live life and get businesses back going. It's a balance between mental, physical, and economic health, and people need that, and I think it's great.
Do you see? So COVID's horrible. I think
Yes.
that we should just say
Establish
that.
that right
Yeah.
now, yeah.
But as it being horrible, there's been a lot of positive things that have come out of it. Over at the health department or even at the Air National Guard, have you seen positive things come as a result of COVID that probably wouldn't have happened previously, or it's driving awareness or driving action in areas?
Absolutely, yeah. I mean, I think the reason that the health department was a lot of the reason that the health department had some of the breaking points that it did was because there'd never been investments in its infrastructure. So they had decades-old equipment. The technology they were using for processing of labs and how those cases would be sent out for, they didn't have the contact tracing system that we have. They didn't have any of that. That was a product of just it not being on the forefront of everyone's mind or focus, and so
Right.
it didn't get invested in.
Right.
And so now that everybody sees that, hey, this is important, and oh, by the way, we didn't invest in it, so we need to now. That's a perfect example out of something that's something good that's come out of it. The health department is going to be completely different when this is over than it was when it started.
So you say that as far as the health department. So let's kind of go there for a second. As far as transitioning at the health department, what sort of things are you talking about exactly?
Well, everything.
Okay.
But let's just start from the I'll start from the emergency preparedness
Oh, that's
response
awesome.
piece,
Yeah.
because
It's gonna be a
that's
long show, folks.
Yeah. Because that's the basis of what we're talking about with the response.
Okay.
But let's say the culture of that department needed to change.
Okay.
The training and preparedness of that department needs to change. The everything from the warehouse that we store our stockpile of supplies and PPE and everything had to be completely redone. The whole way that was done, they would get a shipment of supply from the federal government occasionally, and they would plug in a drive that would tell them what all was on there. They would unload the truck, and when it was needed, they would ship it out.
Oh boy.
They had never, the concept of ever having to go out and establish relationships with the vendors and purchase things, and then the distribution
Right.
and the whole logistics of all that just was not something they could even wrap their minds around.
So, as the health department, you mentioned vendors there. Has one of the, and I hesitate saying benefits, but one of the things that's advanced because of COVID, have we seen a more vast amount of vendors that have kind of stepped forward and being willing to partner with you? And then have you been able to partner with other agencies as well? I mean, you both can probably speak to that.
I can speak to that on PPE. We've seen people come out of the woodwork on PPE. I mean, during the early days as part of the task force, we didn't have a system for managing it. So that was one of the bigger challenges as well. We had central purchasing,
right?
And the governor, I think, had asked Gino to go out and manage that for the state. But we didn't have a great way of tracking, which we do now. And one of the CARES Act's projects is going to help build that also. But from the central purchasing side, which is an OMS division, we saw people coming from all over the planet. Wow. And it was crazy. And the hardest thing about it from our perspective was getting that focus to vet the vendors correctly, which I think in a pandemic, when your hair's on fire, I think actually we ended up with a really good process. I don't think there were that many bumps and bruises. There were a few, but not that many. But on the health side, I mean, I'm sure you guys were getting hammered too from everyone and the mother that was trying to sell some type of
absolutely
cure for COVID or a test or something like that.
Yeah.
So how did you kind of react to that? Because were businesses coming directly to the health department? Or
they were.
They
yes.
were. Gotcha.
Yeah, I was getting. We were getting calls from everybody. But,
that's because I was sending them to. No,
yeah, pretty much.
I was sending them to you.
Yeah, so they were just going. Yeah, I gotcha.
So like, call Steve.
So you look at were most of them. You got to imagine there had to be businesses from across the country, maybe even across the world, reaching out. Have we seen a lot of Oklahoma businesses step up as well?
We have.
Okay.
Well, first of all, let me get to that first part.
Yes,
because you've got to remember when this started, everybody in the world was looking for the same thing. And so it was a full-time, 24/7 job that Gino stepped up to do that.
That's right.
And you helped him out a lot by helping develop that system for tracking and purchasing and all that, which was great. We couldn't have done it without all of that.
Well, and if Craig Brooks is out there somewhere, shout out to Craig Brooks, because he joined the task force, sat right next to Gino, took his requirements, and built that system.
Wow,
so
that is awesome.
Craig got to orchestrate most of that on behalf of OMS.
Yeah, he did a great job.
Yeah.
And so anyway, there was that piece of it because nobody could find it, but somehow Gino could. So that was great. So that helped us tremendously. But yes, there were a lot of Oklahomans that stood up too. It was really impressive to see how Oklahomans rallied together to work together on this. It was really a combination of state, private, commercial entities all working together to try to get through this.
Think about World War II when the U.S. had to change car factories to start manufacturing tanks and planes. It was sort of like that. The gowns started getting manufactured from metal workshops or other manufacturers that just wanted to help and they knew that we were fighting the battle in China. Everyone was Commissioner Frye's right. Everyone in the world, literally business, government, name it, they were all having to go to China or Germany to get the PPE in, and that was a big bottleneck. So people had to start producing it themselves. And gowns, I think, was one of the first things that started getting generated.
Some of the universities and schools started using their 3D printers to make face masks and all kinds of things.
Hey, by the way, speak a little bit about the university's involvement during COVID too, because it seems like they stepped up in a couple of different ways. And Secretary Brown, I think, was also trying to do a deal with them to use them for housing for long-term care patients if we needed it. Yeah. So talk a little bit about your experience with the universities.
That's that partnership piece again. I mean, seriously, they were. I shout out to Johnny Stevens, especially at OSU, because he made it a point to never say no. He's like, I don't care if it costs us money. We're going to do the right thing.
Wow, that's awesome.
And they partnered with us from the very beginning. They basically brought their lab on with ours. So we have our public health lab. We've developed a public health network of labs, which was OU, OSU, this 2 large state academic centers and our public health lab, and then a commercial partner, Emmy Labs, out of Norman, and they all developed to come together under one organization to have more buying power, to be able to work together, and all the things that brings, and took our in-state testing capacity from 100 tests a day to now I think we're at 6,500, and within a few weeks we'll be almost 10,000.
And is that just with the continued effort to expand?
Continued effort to expand. Yeah, they're just continuing to build and improve on what they're doing and improving their processes. A lot of it is just changing the flow and the
like you
processes
said, all this is brand new, right? Yeah, this is
Mm-hmm.
creating from scratch a lot of it. So,
and you're right. The housing that they were going to use the dorms from the universities. It was schools were out at the time, so they were going to use the dorms for some congregate housing for different situations where that might be necessary. They ended up not having to do that, but they had that plan on the books as well.
Wow.
So for Oklahomans who are trying to follow COVID and pay attention to the press conferences and watch the numbers, in your opinion, what are some of the key metrics or key numbers that they should be paying attention to understand where the state is and how we're fighting COVID?
Yeah. Percent positivity is important because that tells you it can vary based off of there can be some bias in it because it can vary based off of how much testing you're actually doing out in communities just as surveillance. So if you're only testing people that are symptomatic, or you're going to a nursing home that has an outbreak or whatever, that's going to knock that percent positivity way up.
Right.
If you're just trying to test everyone and try to get as many people to establish what the baseline percentage is in the state, then that's going to lower that number. We're somewhere in the middle there. States do it differently.
Right.
But that percent positivity gives you an idea of the amount of COVID-19 that's in your community, basically. So that's an important number. But more importantly, really, is your hospitalizations. Sure. That's what we look at.
ICU bed counts.
Yeah, ICU bed counts, hospitalizations, that hospitalization number. And, of course, your fatalities. We don't ever want to have any, but there are obviously some with this disease. We look at the case numbers every day, too, because a lot of times the hospitalizations follow the cases.
Right.
So we follow those trends. But right now, with the universities have been open, our cases have gone up, our hospitalizations have not, and they've been open for a while. So we're doing better right now than we have been.
I'm glad you clarify that because a lot of times you look and a lot of people just want to track the number of cases or something like that. But it's important, from what I'm understanding from you, to look at the different metrics of what is going on to get a more full picture of what the actual impact is to Oklahoma.
Right. Because young people usually don't get that ill from it. Most of them don't end up in the hospital. There are a certain percentage, but most of them don't. Excuse me. So right now, with the schools open, universities open, the trends we're seeing are more of the 18 to 35-year-olds. That 35 and under are more than half of all of our cases in the state. And that 18 to 35-year-old, I think, is like 42% right now of the cases. So it's a considerable number. And those people normally do very well. Most of them don't end up in the hospital. So you look at the percentage in what age groups, and is it going up or down in those different age groups, and then the total number of cases and hospitalizations. That gives you a pretty good picture of what's going on.
Yeah. Sorry, go ahead, Steve.
Well, I was going to say, do you get time to get away from this even for 5 minutes? I mean, you're the leading health professional at the state of Oklahoma for pandemic, and I mean, it's...
Yeah, not really.
I was gonna say,
short answer, not really.
What's life like for the commissioner these days?
We have Zoom meetings starting at 7 o'clock on Sundays sometimes.
Oh, boy.
It's just, I feel bad for I signed up for this. I offered to do it and said, yes, I'll take this on, knowing what I was getting into. Yeah. But I feel sorry for the rest of my staff because they're just being drugged through it along with me.
So talk about this.
Over here,
yeah. Shout out to Jackie Shawnee.
Yeah.
So talk real quick. I mean, Jackie over here. Talk about the staff that you're building, the team that you're trying to build at the health department. What are you looking for? And so far, you feel like you're taking steps in the right direction. Kind of speak to that a little bit.
Yeah, it's funny. I was just talking to my wife about this last night because she was telling me that her biggest concern when I took this job was that I would be, everybody would leave me. My Air Force, friends and people that I trusted and worked with were going to not be there anymore, and here I was going to be taking this pandemic on all by myself, and that just didn't happen. I had great people there already, and we built a good team. So Jackie Shawnee has worked for the health department for over a decade now, and she's fantastic. I can't say enough about her. I couldn't do it without her. Right. So she was there, luckily, and she's like the veteran for me that's been through it all and knows all the information,
right,
and where all the bodies are hidden and all that stuff.
Gotcha. Yeah.
So, but we, she's a rock that's had to stay, and then as soon as I got the position, as soon as it was announced. A friend that I've known for years, Jennifer Leopard, that used to be with the chamber, called me up and said, "Hey, I heard you're going to be commissioner. Hire me."
Right.
And I said, "You really want to leave the chamber and come to work for the Department of Health?" And she said, "Yes."
Really?
She has a doctoral degree in public health, and she
and everybody
said,
knows Jennifer around the Capitol. Yeah.
And she's like, "This is what I've trained for. We're in the middle of a pandemic.
Right.
I can't imagine not being involved, and now that I know that you're there, I want to come over there and work." So she came on, and she's just been a rock star. We've had some of the stable people that were there. That was Keith Reed, Colonel Reed is also in the Air National Guard, and so he was there through the process. But he was a deputy commissioner for the community health portion of the Department of Health previously. So he stayed in that position, does an amazing job. Matt Stacy was he's a intelligence officer for the Air National Guard. I mean, sorry, for the Army National Guard, for the military, and also an attorney here in the state. And
did you say, are all these relatively new to the health department? Or
some are new and some are there.
Right.
So Jackie and Keith were the
that's
ones that have been there.
Extremely important because Steve, I hear you talk all the time at OMES, at least, as you're building a team within OMES and creating change within OMES. It's important to have that balance of those who have been
takes both.
Yeah, those who are new, but then those who have been around and know the ins and outs of the agency.
Sure. So I wanted to bring in people that I've worked with before. I trust. I know they're amazing and excellent, and partner them with some of the really great people that had been in the health departments, and just to come together and move forward with a new vision.
That's cool.
So what's in your mind from what? And I don't want to get into modeling, but in terms of what expectations are going into October, November, December, what are the experts telling you in terms of what we can expect with COVID? With Oklahoma's response, basically.
Yes, Commissioner, tell us what's going to happen.
And by the way, I've got a crystal ball.
Let me look into that.
You're our resident experts.
But as for what you know today, I mean, because obviously this could change in any minute. But I mean, from what you know today, what would be the expectations you think you have going into the fourth quarter?
Even positive. I mean,
I think
for weeks now we've seen our numbers dropping, right?
We've seen we did for a while. We've seen them go up since schools opened, but our hospitalizations have stabilized and they've stayed there. So, and honestly, I thought our hospitalizations were going to go up. They typically follow the numbers, right? Mm-hmm. But because the age distribution has been such that it's a younger group so far, and we're really trying to message for them to, if they get sick, to stay at wherever they're living, not go home and take it to their parents and their grandparents. So, I think they've been doing that for the most part because we haven't seen those numbers go up. So, but I do expect we're probably going to trend up a little bit. We don't know. We've never been through this before, but we expected a seasonal change with the summer. We thought our numbers would go down, and they didn't really. So I think the seasonality piece of it may not be that big of a factor.
Okay.
But we do have the flu coming up. And so
and there's a question today in the press conference about the flu and COVID at the same time and what that might pose as a problem for health officials.
Absolutely. Again, no one knows, but because we haven't been through this, but the things that we would normally tell someone to try to decrease the spread of the flu are the same things we're telling them to decrease the spread of coronavirus. So we're walking into I think our first flu season in the United States where people are already wearing masks. They're already, social distancing. They're washing their hands. They're not touching their eyes and their mouths as much. And so
that's a good point. I hadn't
we're
thought about that.
hoping that decreases the flu considerably. So we'll see. But that is a concern. We're just going to have to watch and wait.
So I'll tell you the craziest thing, and I don't know if you've experienced this. So I'll go to Crest Food and shop for groceries, and every once in a while, because I'm on the phone a lot, I'll take it off and I forget to put it back on. And first of all, always wear a mask. I think we all support that. But if you're like me and every once in a while you forget to put it back on, just be ready for the public shame you're going to get. Because, oh my gosh. And I love, but it's an indicator, I think, that how serious people are starting to take this. And it's funny, because it's not always instinctive. I take it, I'll have it hanging off my ear. I don't even recognize it. Someone will look at me, give me that crossway look as I'm trying to buy some tea or something. And I'm like, oh my gosh, what's wrong? Oh, and I got to, but I love that people will do it.
I'm Commissioner of Health, and I talk about wearing masks all the time, and I try to always wear them. And then I have Jackie or Jennifer, somebody's elbowing me constantly, put your mask back on, put your mask, because I forget. It's the same thing. You take it off to do something, or you just have it on your ear, and then you forget to hook it back on. And
it'll be interesting to me what happens with the psyche of Oklahomans, because even as this eventually will pass, whatever that time frame looks like, when it does, people are going to be so used to wearing masks. Are they going to trust that they're really, really safe, especially for that older population? I mean, look at China. China's been wearing masks for years. I mean, it wasn't just because of the pandemic. Anywhere we've got a mass collection of people, it seems like that they're more open to it. I think long term, it'll be curious to see how Oklahomans react to that. Yeah, exactly. Yeah. For those who couldn't hear Jackie, she was saying when flu season rolls around, it'll be interesting going forward if we continue to see people wearing those masks.
Yeah, I think COVID's going to change. It has changed the world. I mean, I don't think there are a lot of things we used to do that we probably won't do anymore.
Right.
Just change.
Yeah, that's for sure.
So one more thing. So what about buildings? What about when you think about real estate? So it's different because you're a health agency, but at the same time, it means you physically have to see people, but maybe not everyone. Have you guys been able to use telework and things of that nature? Do you see that the real estate, you'll need as many facilities going forward? How's that changing because of what you guys are seeing in COVID?
Yeah, I think it definitely is changing it. Our need for a footprint in real estate is going to be much less. It's changed so much. I mean, I'm thinking about, you talk about teleworking, I'm thinking about telemedicine.
Right, yeah.
I mean, we in the past, I never thought I would do telemedicine on my office. I never thought, I got my office. Patients
That's
will
why
come
you have
in.
an office,
they don't
right?
they don't want to talk to me over a computer or something. And when this first hit, we had to basically close our offices except for emergent situations or high-risk patients, and everyone else we would give them the option to do telemedicine, or some we just said we have to see this way unless things happen. And people adapted to that very quickly. I thought they would be upset about it. They didn't really seem to be that way. And now, now that everybody's back, they'll say, would you like to be seen virtually or in person? And a lot of people want to be seen virtually. They don't want to get in the car and have to drive over there and sit in the waiting room.
That's the thing, the convenience factor.
Yeah.
It's way more convenient to sit in your living room at home and talk to a doctor over a video conference or something like that.
Yeah.
Are more physicians getting open to it?
Yeah, they are, absolutely. Yeah.
Because I think there's and I guess I'm assuming it depends on the discipline. Probably, family medical practice, it's probably easier. But if it's surgical, I don't know.
It's more difficult. Yeah. I mean, I think you have to figure out what works for your practice and what patients you could see virtually, which ones you shouldn't. And
wait till your iPhone becomes an x-ray machine.
Yeah.
Or you can do an MRI from your iPhone.
Yeah.
When that happens.
See, now we're about to get Steve going on
there you go.
This is where it gets real fun.
That's right.
So real quick, because we dove in a little bit about your background, but walk us through like your entrance into serving. One, your background military serving, but then also your service to the state and the roles you've had before. What is your background to lead to this point, I guess, in your career?
Well, I grew up in a small town, Oklahoma. I grew up in Lindsay, Oklahoma. Ended up going to school in California. Went to medical school there, and afterwards stayed, practiced there for several years.
Right.
And I think I was just getting a little. I'd always felt a desire to serve.
Right.
Even when I was in medical school, I thought about joining the military, but I just didn't really. I guess felt like I had enough information to make that decision.
Right.
You're in the middle of medical school, so it was just didn't feel like I could spend the time researching and diving into it. So I eventually was talking to somebody that was in the military, and they said, why don't you join? And I honestly didn't have a good answer why not to join at that time. Something I always felt like I wanted to do, and I had the opportunity and ability to do it at the time.
Right.
So I just said okay. So I basically gave away my practice. I called up a guy I knew that took all the same insurances and had the same kind of patients I did, and I said, "You want my practice?" And he said, "Sure." He said, "How about you at least let me buy you a steak?" And cause I said, "All right," because he asked me how much I wanted. I said, "Nothing. Just take care of my patients and my employees.
That's awesome.
I'm good."
That's cool.
And I opened up my house and told my friends to come pick anything they wanted out of it because I was going to downsize and go. Thought I'd rather my friends have my stuff than sell it in some garage sale or something.
Right.
So did that. I joined the military, and it was the best decision I ever made. Loved it.
So was all this in Oklahoma, or were you moving all over the country, or kind of?
It was in different places. I was when I joined the military. I joined as a flight surgeon, even though I was trained as an OBGYN.
Okay.
But I told them, because they came and asked me if I would be willing to do a flight surgeon. And I said, I don't even know what one is. And they said, well, here, look at this, watch this video, and go with me to Luke Air Force Base and fly in some fighters, with the guys. And so I thought it was amazing. So I was excited. It was really the
awesome.
operational side of medicine. It was, the deployments and, setting up everything and doing the air medical evacuation and everything. So I thought, well, where else will I ever get this opportunity?
Absolutely.
So
and experience through that. That's amazing. So how much of that do you take that to what you're doing today?
Oh,
every day?
Yeah. I mean, it's not, like I did everything from point of injury, flying in a Black Hawk at point of injury pickups in battlefields in Afghanistan, to being in charge of air medical evacuation pieces back to the United States. But it's just that the whole training that they give you as far as being able to work through crisis and emergency.
I was going to say, you can't truly simulate a crisis situation. The fact that you've been through that and you've lived through that, there's nobody better suited for the position than you're in, because you have that mentality. You've been through that. So
I want to get into, you mentioned Lindsay earlier.
Yes.
Does the name Eddie Morrow ring a bell?
Yes.
So funny story. So his wife, Janet Morrow, runs our risk group at OMES. And when I moved to Edmond, Eddie, who, just a small world story, was my realtor. And we get to talking, and I think, how'd you come up? I think there was a press conference or something that popped up, or I was watching on my phone, and he's like, "Hey, I know that guy." He goes, "That's Lance." And it was, because Lindsay's not a big place, right?
No, it's not a big place,
and there was another friend that they had over, I'm horrible with names sometimes, I can't remember his name, but also you'd know him if I could remember it. So Eddie Morrow, if you're out there, when you see this, text me who was all there so I can make sure Colonel Frye gets that, because they couldn't go on. They were like, "You are the perfect guy for this job."
That's awesome.
Oh, that's nice.
Yeah, absolutely. So when you see Eddie, pay him the 20 you owe him.
Okay, yeah.
One more thing I wanted to get your thoughts on. One real hot topic right now is as everybody's going back into schools, we got our teachers back into schools, we got students obviously in schools. Teachers being tested. Can you kind of walk us through, this is a major topic right now, what's the health department's role in this, and then walk us through how you foresee kind of that playing out?
Yeah, so we encourage testing. the more testing, the better.
Yeah.
I mean, that's how we know what's going on in our communities, schools, et cetera. And so we want to encourage that. I know that COVID has worn on everyone, and a lot of people are done with it. They don't want to go get tested or anything anymore, but it really is important. So first of all, I just want to encourage that. But we have set up different plans for getting all the teachers the ability to be tested once a month. And so we wanted to go through and try to test as many. It's optional for them to opt into it. We can't force them to do it, but we want everyone to be able to get an initial test and then be able to test monthly as they want or feel the need to.
Right.
And a big part of that is going to be the fact that OSU's lab just got validated for saliva. And so they finally got in EUA. Those are very hard to do. They're the first one in the state that's got it.
That's awesome. That's a big
for
deal.
Saliva. It was a big deal.
That's cool.
And so they moved their lab to Stillwater over this last Labor Day weekend. They've got it set up. They're ready to run. They're doing some final things. We've already done some initial trial and error tests with them and kind of worked out some pathways. So the great thing about that is that's a collect at home specimen. Yeah, I mean, it can't be easier. You just spit in this little tube and then screw a top on it that has a reagent run down in there, and it deactivates the virus at that point in time if you are positive, and you just mail it back into OSU and they run the test.
Really?
That's awesome.
Yeah. Man, so that's the sort of things that we're like, because I know like right now you talk about testing and you have these horror stories of getting the big stick shut up your nose or something like that, and people just dreading it. So there are different things being developed to develop better and faster, more efficient testing. Is that correct?
Absolutely. And when we did the long-term care testing, which was similar to schools, we went through and tested every employee and resident of every long-term care facility in Oklahoma. That was a logistical problem. I mean, it was difficult to do. So being able for them to be able to do it themselves and then just mail it back is fantastic.
What about sporting events? So we've got high school events that are going right now. There have been high school teams that have been quarantined. My youngest daughter, Jenna, goes to Lincoln Christian in Tulsa, and they played Beggs first game of the year. Great game. We were lucky to come out on top. But then one of the players on, I believe, Beggs tested positive. Then both teams had to be quarantined. But there seems to be this process where someone is going back and reviewing the film and doing some contact tracing, watching video. Is the health department involved in that? Do you know how that works?
Can we go to another topic? No. Yes. We are working through all of that, and it is a painful process
I can imagine.
It's Friday night football in Oklahoma, and it's important to people.
Yeah.
But we want to be a partner with these communities and schools and partner together to do the right thing and keep everybody safe and help them through the process. But we don't want to come across as a regulatory hammer.
Exactly, right.
You
don't want to be the bad guy with the bad news all the time.
But the truth is, people have to be quarantined sometimes.
Right,
that is the hallmark of the cornerstone of being able to stop the spread of disease.
Well, and fatigue. I mean, fatigue from COVID has set in communities, right?
Right.
And Friday night football is something that those communities look to come together and experience life together again over a sporting contest. That's got to be difficult.
It is, and there are. So we're the state health department, and so everybody thinks everything that happens in the state is underneath this. It's really not true. That the city, county, the two large metros are separate, and they have their own boards that they report to. And so we try to coordinate all of these efforts as much as we can so that everyone's getting the same information or having the same, following the same guidelines as we're moving through. But when you get in a situation like this, I mean, there are no, the CDC has not given guidelines for contact sports. There just aren't any. And so we are using the most, we're extrapolating the data from the knowledge that we do have to use towards that, but we really don't have any set guidelines. So we're trying to coordinate that, but sometimes it doesn't happen. And so Oklahoma City County may tell someone to do something, and we tell somebody on the other team to do something else, and then they want to know why both teams weren't treated the same way. But we really are trying to work together and coordinate the best we can. But it's tough. So we're trying to be less everybody's going to be quarantined, to more really look at each situation,
right.
Spend a lot of time going through it. Game films are tough because, there might be a tackle that's not captured in that particular
right.
Film that happens off camera. So we do the best we can, and we are participating in that and trying to be as granular as far as just. Normally we don't want to be granular, but in this case we do, because we want to just quarantine the people that need to be quarantined, right. And not everybody.
So for clarity's sake, though, is the health department or your staff being asked to look at all film, or only those where we have someone we know tested positive?
Only where people have tested positive.
Yeah, because that would be a massive undertaking.
And we're working with...
have a game film department.
Yeah.
Man.
Yeah. So
Huddle's going to call you.
I know, right? Yeah.
I hear an opportunity knocking.
We're working with the Oklahoma, Sports Association.
Right.
We're working with... we're actually... I've been talking to the CDC about it, because they're saying, hey, we don't have any guidelines. We would love to come work with you and try to develop some guidelines. And we're learning as we go. We're trying to make it better.
Talk about the interaction of the White House. I mean, I know that either through yourself or through the governor obviously has a really good relationship with Trump, but what's the relationship between the state of Oklahoma and the White House as it looks for health and COVID? And are they asking for feedback? Are we able to provide feedback to them?
It's a great question. I sit on a lot of those White House calls for with the governor, the weekly calls that we get, and I feel like there's a really good relationship. Dr. Burks came here, and she was very. She came in initially, not knowing exactly what environment she was going to get into, so she came in asking a lot of questions, and by the end of our conversation, she was very complimentary of what we've done in the state and how prepared we were, and said that it's not always that way when she goes to states and talks to them. So I feel like we have a good relationship. During this process, HHS, a White House fellow, contacted me on a weekend and wanted to talk about our rural health care system, and that he had been tasked to basically to develop rural health care system using COVID as the platform. What are we doing in rural health care?
Right.
So I told him what we had done with our healthcare plan. We had deployed telemedicine units around the state. We'd done a lot of things in regards to that, and he was impressed. So we sent him a copy of our surge plan and what we had done. He circulated around to everybody in D.C. They ended up coming back to us and saying, we want to use you as an example for the rest of the United States. Let's develop a statewide plan that we can help you with to improve rural health care in Oklahoma, and then we'll use it everywhere. So we started at that level. We ended up dropping down to we're gonna do a pilot study. We've chosen McCurtain County. We should be able to start. We haven't announced this yet, so this is
breaking news.
Breaking news. But we should be doing that sometime within the next month. We were hoping within the next 2 weeks to really get this up and running. And if that works well there, then we're going to do it in other counties around Oklahoma. If it works well there, then hopefully we'll do it throughout the United States.
It's awesome to hear, like, the innovation behind it and everything that you're working on. That's the really cool part. That's the exciting part of the opportunity to be innovative in all this and serving Oklahomans. That's what really just listening to you and everything, all the work you're doing at the health department. Just thank you very much for the way you're serving, because it really means it means a lot to Oklahomans. So thank you very much.
Absolutely. It's like I said, I couldn't imagine. People ask, why would you do this in the middle of a pandemic? Well, I can't imagine not doing it.
Yeah.
So think about this, right? And we've talked to a lot of everyone that's come on the podcast so far. Pandemic, energy crisis, all the social issues that have been going on, unemployment crisis, all at the same time as while we've been in 2020. My kids sometimes would ask me, Dad, why'd you choose this time? This is the best time.
Yeah.
If you really want to step up and have an opportunity to serve and make a difference and help people, be a servant like OMS is called to be, or us in our individual roles. It's amazing. This is the time if people really feel a calling to serve either militarily or within Oklahoma, especially if you're in Oklahoma looking for something to do, be a neighbor. You can go there and find something. Call the health department.
So many opportunities.
There is. I mean, and we have plenty of mechanisms easily that are available to you that you can get hooked up to help people anytime, day or week. So
absolutely.
Well, Commissioner, I know you are probably the second most busy person, I think, maybe in the state, maybe right behind the governor. And I know your chief of staff's told us you got a pretty hard stop here, but before you have to go, thank you so much for coming on the show. We definitely want to have you back because we just scratched the surface on the topics that we want to talk about.
We could talk all day, to be honest with you.
Really, because there's so much there, and you are so impactful in what you're doing, and we want to stay up as you're developing and creating change within the health department. We want to learn about that. We want to see what's going on there. So, but thank you very much for coming on the show.
Thank you for having me.
Thank you for your service to the U.S. military.
Yes.
Thank you for all the veterans that you're pulling in. I think that's amazing.
Amazing. Yeah.
We're trying to do that. We just hired the commander at the 504, Tinker. He's going to come lead infrastructure for ISD. So
great.
I've got a soft spot in my heart for veterans. I wanted to be one, but couldn't pass the test, but with my knees. But
that's cool.
Man, that's so awesome. I mean, we literally are. Oklahomans don't realize how privileged we are to have you on the team and your whole staff. So thank you for all you do.
Thank you. Appreciate it.
Well, guys, thank you so much for tuning in to watch this episode. Really, Commissioner Frye, so much he's doing for our state. So thank you again for coming on the show. And we'll have another episode coming out soon. If you didn't get a chance to watch our previous episodes with Chip Keating, and we talked a lot about the public safety aspect of this, how the different what's going on in the state and our country. I've talked a lot about that in the last episode. Make sure you check that one out as well. Anyways, thanks again, guys, for tuning in, and we will see you again on the next episode of the GSD podcast. Thanks, guys.
See you guys.
Thank you. Bye-bye.